healthcare with nurse practitioners and physicians who've got some room in their practice. It's extraordinary that we are at the point that we're able to now do this and to have an event like this, inviting people to come to register and participate. I was elected in 2003. Pat had been in the legislature for some time by then. And I remember knocking on doors in my riding in London North Centre. That's actually the north and centre part of London. We hear statistics, and then we meet people. And I think people who are privileged to just hold public office are in a special position where we get to actually meet some of the people behind the statistics. I remember knocking on doors, and I met a woman who was about my age, and she lived in London. Her mom lived in Toronto. Her mom was elderly, needed some extra care, so the mom moved to London to be close to her daughter. They had been unable to find a doctor for the mom, so she had moved from Toronto to London, but she was still going back to Toronto every 2 weeks to visit the doctor. So it was a kind of absurd situation, but that's how that was the shortage that we had of family health care providers at that time. I was going through some press clippings, and I came across a story dated September 23rd, 2003, where a community forum was being held here in Chatham at St. Paul's Church to talk about what was going to be done to address the doctor shortage. That's how serious the problem was not that many years ago. We got elected in 2003. We increased the number of medical spaces in medical schools. We've now doubled the number of international medical graduates who are graduating. By 2013, we actually will have doubled the number of doctors we graduate every year. That's an extraordinary expansion of our healthcare capacity.